What have I been saying about single-payer healthcare and Democrats for months now? I have been saying make Medicare for all or some version of single-payer part of the Democratic platform. H.R. 676 was introduced in the House in January. Medicare for all, barely a ripple. Told you yesterday, Senator Bernie Sanders will introduce something in the Senate for single-payer healthcare. Hopefully that gets more attention, although it's not clear. There are now some Democrats running in the 2018 midterms on single-payer healthcare, and I guess they're getting some attention. One is Randy Bryce, who's an iron worker. He's running against Paul Ryan in Wisconsin, so he's got quite an uphill battle going. He's pushing Medicare for all. His first campaign video was actually about healthcare, and it went viral. He's off to an interesting start. Amy Villela is primarying a Democrat in Nevada because the Democrat incumbent didn't sign on to Medicare for all. She actually lost her 22-year-old daughter tragically a few years ago, alleging that hospital staff didn't treat her daughter's blood clot because she didn't have insurance. Clot traveled to her lungs and ultimately caused a pulmonary embolism. You've then got Dave Benak for the Michigan 6th District, also running on universal health care. And Dorothy Gask is running in Washington's 3rd Congressional District. I don't know if these people have a shot, right? But I do believe that unless the Democratic Party makes this part of its platform, individuals running on single payer, particularly non-incumbents, aren't going to benefit that much from it because you've got these sporadic individuals saying, I'm running on single payer. If it's just this sporadic support, I don't know, Pat, how much of an impact it's going to have. I believe that the Democrats really should make this part of the platform. It doesn't matter that you're not going to get it with a Trump administration, Republican House and Senate. Make it part of your platform.
You can't run a 2018 midterm campaign on just defending Obamacare alone.
Right.
Because what is that? The status quo. It's the same effect that Hillary Clinton tried to go after, right? Just keeping things the way that they are. The way that Republicans were able to win elections in 2010 and 2014 and in 2016 were by going on a proposition, right, to repeal Obamacare, to actually do something else.
I completely agree with you. And compounded with that is the problem of sort of a general lack of public awareness of what's going on. On paper, 33% of Americans support single payer. That's an increase since January of 5%, according to a new Pew poll from last month. That might suggest a lot of people just don't know what single payer means because the exact same survey showed that 60% of Americans believe the federal government should provide health care to all Americans, but only 33% of Americans are for single payer. And that is part of single payer being a kind of awkward phrase. And I think that universal health care is much more appealing and clear. Medicare for all, I think, is much more appealing and clear. And single payer is both confusing and it sounds maybe more costly. And I think it continues to be a messaging issue as well.
Oh, if you phrase this poll question as, do you support Medicare for all? I'm sure those numbers would be a lot higher, especially because as an entitlement program, it's the second most popular one. It's at like 77%. And people know what it is. So I think that number, 60%, even higher, would be the result of that.
One other idea I want to propose, Pat, if you will allow it. Donald Trump has historically been in favor of single-payer health care. Not shocking, since he's taken most positions on most issues at some point in his life. Trump has had failure after failure on the Obamacare repeal and replace. Trump's promise was get rid of the Obamacare program and replace it with something beautiful that will work for everybody. What if some Democrats privately reached out to Trump and said, listen, we want to work with you to give you a major success in keeping a campaign promise and doing something really good. Let's work together on Medicare for all. You would only need some Republicans to come to your side. It's insanely unlikely, but Trump is nuts. It could actually work, couldn't it?
Maybe. I mean, Donald Trump doesn't really know what he's talking about when it comes to healthcare, and we know that he's easily persuaded. I mean, he was like a Democrat until, 2010,
2 years ago.
A few years ago, until he
enough.
found birtherism.
Right.
So he could go along with it.
Send me your thoughts. What about that? Thanks for joining us on the bonus show. Different bonus show today because of our full interview with Peter Boghossian on the broadcast show. Back to the normal setup tomorrow. Today's program is made possible in part by Tagadab, the hosting specialists. They host websites for everybody from bloggers to businesses to financial traders. You can get virtual, dedicated, and private server solutions, cloud server solutions, custom server solutions, whatever is right for your project or business is available at Tagadab. And with a growing number of people increasingly interested in moving their businesses and projects to the cloud, Tagadab is offering our viewers and listeners a 20 British pound free credit when you sign up to give you a chance to try out their cloud server solutions. This is a limited availability offer, first come, first served, for viewers and listeners of the David Pakman Show. To take advantage, go to signup.tagadab.com/TDPS and use the discount code TDPS20 during your account registration. 20 British pounds, roughly 23, 24 US dollars. Once again, check it out, signup.tagadab.com/TDPS. The discount code is TDPS20.